Hi everyone, I'm Chiara Bellocchi, EUSTAR Young Investigator from Italy. I'm glad to be here today in Vienna for EULAR 2024, and I'm with Prof.Ariane Herrick. I'm very glad to be here with you. So my first question for you is if you can talk about the SCTC, so the Scleroderma Clinical Trials Consortium visiting fellowships.
Yes, well, thanks very much, Chiara. I'm very pleased to have the opportunity to say a little bit about the fellowships, the visiting fellowships. So the overarching aim of the fellowships is to try to foster the next generation of clinicians and clinician scientists in the field of scleroderma. So we're very aware that sometimes for early stage researchers, they need an opportunity to engage with senior researchers to just have that sort of step up on their road towards either an independent research career or setting up their own scleroderma unit. So that's the aim of the visiting fellowship, that we should give opportunities to individuals who can make the most of them, essentially.
Sure, and this is amazing for young investigators. So I have another question for you. It's a curiosity. So I know that vasculopathy is one of your main fields of research, and specific capillaroscopy. So do you think that the capillaroscopy is still the main protagonist for diagnosis in scleroderma, especially in the early phases, or do you feel that are new emerging tools?
Well, I'm obviously a bit biased because I'm a great enthusiast for capillaroscopy, but and of course there are other things. There's all the VDOS study has very beautifully shown the other parameters. I do think that capillaroscopy is important. I think it's important in diagnosis because it's such a neat and easy tool if people become familiar with it. I think that advances in capillaroscopy, for example, now that we know that there are different types of equipment which are lower costs and can give very good images, and now that we're training more individuals to be happy not only about image acquisition but about image interpretation, I do feel that the time is right to really focus on capillaroscopy. But capillaroscopy has so many other advantages in telling us about pathophysiology and about potentially a risk predictor, potentially an outcome measure maybe in the future. So I think there are a lot of reasons why capillaroscopy should be promoted, but I think certainly in early diagnosis, I think it is important. I think for the patient with Raynaud's who's got definitely abnormal capillaries, then that's a very strong prognostic sign.
Yes, thank you so much.
Thank you. Thank you very much.